The new Secretary of Health and Human Services, RFK Jr., is a well known vaccine skeptic, and he's called for more data on their safety. Chris, I think that scientists like you and me probably agree that there's already a lot of evidence that there is no link between vaccines and conditions like autism, but lots of people in the public still aren't fully convinced. Now, it's been reported that the CDC may launch a new study on a possible connection between vaccines and autism.
Yeah, and Bapu, it does kind of make you wonder if having more data on this subject is really going to do anything to change anybody's mind on either side of this issue.
Yeah, it's a good question because if high profile vaccine skeptics led their own study, it may be hard for the mainstream scientific community or lots of Americans to get behind it and to trust its results. But on the flip side, if experienced researchers who previously advocated for vaccines, if they were to conduct their own study, vaccine skeptics might be likely to continue to dismiss those results.
There is actually, though, kind of a clever way to do research on controversial topics like this one. It's something called an adversarial collaboration. And the idea here is that you have two groups or scientists with opposing viewpoints get together and perform the research together to arrive at conclusions in a mutually agreeable way. But in order to do this, both sides need to commit to three things. Number one, they will both make good faith efforts to really understand and fairly characterize the opposing viewpoint.
And number two, I think they both have to work together in advance to design a study that both sides agree would have the potential to change their minds.
Yeah. And then number three is they have to stick to that plan. So execute the plan and then publish the results together, regardless of what they find.
If people on either side of the issue aren't willing to engage in an adversarial collaboration, it should call the seriousness of their concerns into question.
Yeah, and an adversarial collaboration on vaccines could be really powerful, but there's no reason to stop there, right? So if something like this was successful and productive, we could use an adversarial collaboration on vaccines as a model or a template for addressing some of the other politicized or controversial issues in public health or in science more broadly. For researchers, engaging with those who have lost trust in the scientific community and doing so in good faith and without condescension seems like a really good way to actually start rebuilding that trust.